Usually when we talk about like a medical diagnosis or understanding our own psychology, there's this underlying expectation of precision.
Right, like it should be an exact science.
Exactly, like engineering or something. You break your arm, you go to the hospital, the x-ray shows that jagged white line, and the doctor just points and says, there it is, that's the problem.
It's binary. I mean, it's clean, the bone is broken or it isn't. And we find a deep psychological comfort in that visibility, you know?
Oh, absolutely.
We desperately want the messy, invisible struggles inside our heads to be categorized into neat little boxes.
But then you step into the world of human connection. You step into neurodevelopment, childhood trauma, relationships, and suddenly, well, that x-ray machine is completely useless.
Yeah, it doesn't work at all.
Right. The diagnostic landscape we're looking at isn't clean, it's murky, it's profoundly complex, and yet, if you look at how we are currently treating our emotional lives, you'd think we all had personal x-ray machines in our pockets.
That is so true.
I mean, I'm talking about the very modern, very common phenomenon of scrolling through social media, seeing a 30-second video with a catchy trending sound, taking a highly generalized, like, 5-question quiz in the caption,
Oh, yeah.
and suddenly diagnosing your entire emotional life.
It happens every single day.
Mhm.
Millions of people are just outsourcing their psychological self-understanding to an algorithm. They take a quiz, get a label like anxious attachment or avoidant, and, well, they just adopt it as a permanent identity.
Which is exactly what we're getting into today. Our goal for this deep dive is to look at a truly fascinating document. It's titled Modern Attachment Theory and the Limits of Digital Self-Diagnosis.
It's a great source.
We're going to explore exactly what these viral quizzes get completely wrong about the mechanics of human attachment. We're going to dive into the very real neurological danger of mistaking a catchy digital label for an actual cure.
Crucial distinction there.
Yeah. And then we're going to map out how actual profound healing happens in the real world. Specifically, we'll be looking at the details of a telehealth practice in Georgia that is fundamentally changing how this work is done.
I'm really looking forward to that part.
Okay, let's unpack this. The source document starts by completely dismantling the core premise of these viral internet quizzes, this idea that you belong in one neat little box forever.
Yeah, that assumption of permanence is, well, it's the fundamental flaw of the social media approach. These quizzes treat attachment styles like a personality type, like you're an introvert or you're left-handed or you have green eyes.
Right, like it's baked in.
Exactly.
Mhm.
But the source material makes a crucial distinction right out of the gate. And it's a distinction that completely changes the paradigm. Attachment is not a personality type at all.
Okay.
It is a pattern. Specifically, it's a pattern of protection that your nervous system learned when you were very young.
Let's drill down into that because learned pattern implies something entirely different than personality. If it's a personality trait, I mean, it feels baked into my DNA.
Right.
But if it's a learned pattern, that implies there was a mechanism, there was a reason I learned it, and theoretically, there's a way to unlearn it.
Precisely. Let's look at the how and the why of this. Your nervous system's primary job is to keep you safe and keep you connected to your caregivers. Because for a human infant, connection literally equals survival.
You literally can't survive without them.
Exactly. So if a child has an inconsistent caregiver, someone who's sometimes warm but sometimes ignores them, the child's nervous system realizes, oh, a baseline level of connection isn't guaranteed here.
Wow.
Yeah. It thinks, I need to turn up my volume to get attention.
That hypervigilance, that clinging, is the nervous system adapting to scarcity. It's a brilliant survival strategy.
And that's the anxious style. Yes. That is what we later call an anxious attachment style. On the flip side, if a child's caregiver is consistently overwhelmed or dismissive, the child's nervous system realizes expressing my needs pushes my caregiver away, and I need them near me to survive.
So they just shut it down.
Exactly. They think, I will suppress my needs. I will shut down my emotional expression to maintain whatever proximity I can.
Yeah.
And that adaptation is what we call avoidant.
So it's almost like these 30-second online quizzes are treating our highly complex adult brains like the Sorting Hat in Harry Potter.
Oh, that's a great way to put it.
Right.
Right.
You sit down, you answer 5 incredibly vague multiple-choice questions on your phone screen, and boom, the digital Sorting Hat shouts out, ah, yes, team avoidant. or team anxious,
Yep.
and suddenly you think you are permanently sorted into that house for the rest of your life based on this tiny sliver of data. I mean, it's absurd when you really look at the biology of it. It's totally divorcing the label from the survival mechanism that created it.
What's fascinating here is when you strip away that sense of permanence, when you realize this is just biology trying to protect you, you uncover an immense sense of relief.
That makes sense.
The source text emphasizes over and over that your attachment style isn't a flaw, it is an adaptation. Your nervous system simply did its absolute best with the resources, the environment, and the imperfect humans it was given when you were a kid.
It's just legacy software.
Yes.
It was written for a specific piece of hardware 20 or 30 years ago, and it ran perfectly in that childhood environment to keep you safe. The problem is, you're trying to run that same software on modern hardware in your adult relationships, and it's glitching out.
That is a perfect way to conceptualize it. And the most empowering part of understanding this as a childhood nervous system adaptation is realizing that you are allowed to update it.
You can download the patch.
Exactly. Your nervous system is plastic.
Yeah.
It's capable of neuroplasticity. You are not a broken person. You just have old software that desperately needs a patch.
But the quizzes don't tell you that.
No, they don't. When you take a short digital quiz, it completely ignores that plasticity. It forces you into one of 4 clean buckets, when the biological reality is that most people are a deeply messy, shifting mix of these styles. Real human nervous systems simply cannot be sorted so easily.
Which brings up a really crucial question. If attachment is an adaptation rather than a permanent personality trait, and my nervous system is constantly scanning my environment, then it naturally follows that this adaptation is going to change depending on my current environment. Yeah.
Absolutely.
And more importantly, it's going to change depending on the specific people I am interacting with right now.
Context dictates everything. Your nervous system isn't just looking inward. It's constantly reading the micro-expressions, the tone of voice, the reliability of the person sitting across from you. Because of this, the document points out that your attachment style can and does change with different people.
Wait, hold on. Wait, so if I'm anxious with my romantic partner, but totally secure with my best friend, the social media quiz is essentially useless because it's only measuring one dynamic. I mean, you're telling me I can be avoidant on Tuesday with one person and anxious on Friday with someone else?
Yes, you can.
That sounds like total chaos. Doesn't that defeat the entire purpose of even having these categories?
If we connect this to the bigger picture, focusing solely on the self, which is exactly what a solo digital quiz does, completely ignores the reality of human connection. Attachment is a two-way street.
Right, it takes two.
Exactly. It doesn't exist in a vacuum inside your own brain.
Yeah.
It is created by the space between two people. The relationship itself is the entity. So when you say it sounds like chaos, it's actually the opposite. It's your nervous system being incredibly precise.
Oh, wow.
When you feel anxious with one person and secure with another, that dynamic is actually telling you something vital about the relationship you are currently in. It might be picking up on tiny inconsistencies in your romantic partner that just aren't present with your best friend.
Wow. Okay, so the relationship is the variable. The TikTok quiz tells you you are an anxious person. You are the problem. But the biological reality is you are experiencing an anxious dynamic within this specific interaction because of how your two nervous systems are interacting. I mean, that is a massive difference.
It completely shifts the burden. You're no longer carrying this heavy, permanent label on your shoulders as if you were fundamentally broken. You are simply reacting to the context. This explains why the internet's obsession with these labels is actually creating a barrier to real mental health progress.
Because if these styles are highly fluid and deeply dependent on the specific relational dynamics we're in, it reveals exactly why just slapping a label on yourself while sitting alone in your bedroom doesn't actually fix anything.
The source is remarkably clear on this point. Labeling yourself is not healing. Knowing you are avoidant because a video told you so doesn't magically rewire your vagus nerve to suddenly tolerate emotional intimacy.
Here's where it gets really interesting. The text uses this incredibly sharp phrase to describe what happens when we stop at the label. It warns against getting stuck in identity fixation rather than insight generation.
Yeah, that's a brilliant phrase.
It's such a powerful, almost damning way to frame it. Does that mean we actually use these social media labels as a shield? Like a socially acceptable excuse to avoid doing the actual terrifyingly hard work of changing how we relate to people?
That is precisely the danger being highlighted. Our brains love predictability. Even if a behavioral pattern is making us miserable, If it's predictable, the brain categorizes it as safe.
That makes total sense.
So when someone self-diagnoses from social media but never enters actual treatment, that label becomes an identity because a permanent house they live in rather than a door they walk through.
They just start there.
Yeah, they become fixated on the identity of being anxious.
Yeah.
And suddenly, instead of working on self-soothing, they say, well, I can't help texting my partner 15 times an hour. I have an anxious attachment style. They use the diagnostic language to excuse the behavior rather than generating the insight needed to shift the pattern.
They weaponize the therapy speak against their own growth. It's the illusion of doing the work without actually doing the work.
Exactly. The text argues that the real work of attachment change absolutely does not happen in isolation. You cannot heal a relational wound by yourself in a room scrolling on your phone. Healing happens slowly in the ongoing practice of secure relating.
So you need another person.
Yes. And crucially, because our nervous systems are so heavily guarded, this almost always requires professional help. This is why therapy is so vital. Therapy is essentially a laboratory. It's purpose-built to support the slow, ongoing practice of secure relating.
That's interesting, a laboratory.
It provides a safe, consistent relationship where your nervous system can actually practice being secure, test boundaries, and experience rupture and repair in real time, rather than just reading a summary of it on a screen.
I'm picturing it like the difference between reading a highly detailed book about how to swim, maybe taking a quiz on what kind of swimmer you are, and actually getting into the pool with a swim instructor.
That's exactly it.
You can know all the theory in the world, but until you're in the water, feeling the resistance, having someone guide your breathing, your muscles haven't learned a thing.
That's the exact mechanism.
Yeah.
You cannot learn to relate securely by yourself. You have to be in relation to someone else to update those deep childhood adaptations. The therapist acts as that secure base, allowing your nervous system to finally download the new software patch.
So if the healing explicitly requires the slow, ongoing practice of secure relating with a licensed professional rather than just solo screen time, how do we actually do that? Because let's be honest, access to that kind of specialized help is a massive, very real hurdle for a lot of people.
Oh, definitely.
You have geographic barriers, financial barriers, cultural barriers. This brings us to the specific practical therapy resource outlined in our sources today, which serves as an incredible case study for how modern therapy is adapting to solve these exact problems.
Yes. The source transitions from theoretical psychology to a very concrete example of how this work is being facilitated in the real world.
Yeah.
It introduces a practice called coping and healing counseling, or
Wow.
CHC.
Right.
And what's crucial here is analyzing how their structural model directly addresses the nervous system barriers we just discussed.
Right off the bat, what stands out about CHC is their reach and their format. They are a 100% telehealth practice, fully high-pay compliant, and they serve all 159 counties in the state of Georgia.
Now let's look at why that format matters psychologically. When someone is dealing with severe anxiety or trauma, simply getting to a therapy appointment can trigger their nervous system into a state of hyperarousal.
I can imagine.
Think about it. Navigating traffic, finding parking, sitting in a sterile, unfamiliar waiting room with strangers. By the time they actually sit down with a therapist, their defenses are completely engaged.
They're already in fight or flight before the session even starts.
Exactly. Telehealth physically allows the patient to remain in their safe zone, their own living room, their own couch. This means their nervous system starts at a lower baseline of anxiety, which might actually accelerate the attachment healing process because they are immediately more receptive.
That makes so much sense.
Furthermore, that geographic reach across all 159 counties means whether you are in downtown Atlanta or a remote rural farming community where specialized trauma care simply doesn't exist, the physical barrier to entry is entirely removed.
And it's not just a solo practitioner trying to manage all of this. The text outlines that CHC has a diverse, culturally competent team of over 15 licensed therapists. We're talking licensed clinical social workers, LCSWs, licensed professional counselors, LPCs, and licensed marriage and family therapists, LMFTs.
Which means they had the clinical depth and the rigorous training required to match the immense complexity of human attachment. But the phrase culturally competent is doing a lot of heavy lifting there, and it's vital to explain how that impacts the nervous system.
How so?
Well, our attachment styles and childhood adaptations don't happen in a void. They happen within specific cultural, racial, and systemic contexts.
Right. If you go to a therapist who doesn't understand your cultural background, you have to spend the first 5 sessions just explaining your baseline reality.
And having to explain, justify or translate your cultural existence is exhausting. It puts the nervous system on the defensive. Having a culturally competent team ensures that the context of a person's life is immediately understood and respected.
They can just jump right in.
Yes, the patient doesn't have to be the educator. They can just be the patient. That creates immediate psychological safety.
And their scope of treatment reflects that complexity. They offer individual therapy, couples therapy, family therapy, and team therapy for ages 13 and up, along with life coaching. And look at their specific specialties: anxiety, depression, trauma, and PTSD, grief, relationships, and stress.
If you look closely at that list of specialties, you'll see they are all deeply intertwined with how our nervous systems adapted during childhood. Trauma, relationship struggles,
Right.
chronic stress. These aren't just isolated issues.
No, not at all.
These are the specific arenas where our old, unpatched attachment software causes the system to crash. Treating these specialties is essentially doing the deep work of updating those adaptations.
So what does this all mean? It means we are looking at a paradigm shift. We are talking about someone sitting in their house in Georgia, watching a confusing TikTok that makes them feel completely broken and permanently flawed. And instead of just accepting that digital label and spiraling into identity fixation, they have a direct lifeline. They can reach out to a highly qualified, culturally competent, licensed professional right from their couch. But here is the part that actually stopped me in my tracks when I read the source material: the financial accessibility. The document explicitly details that for Medicaid patients, CHC has a $0 copay. Zero.
That is a remarkable structural intervention. When we talk about barriers to insight generation, the biggest hurdle is almost always cost. Financial stress is not just a logistical problem. It is a profound biological trigger.
It's a huge stressor.
Scarcity tells the nervous system, we are not safe. So if therapy costs $200 a session, the brain perceives the therapy itself as a threat to survival. By offering a $0 copay for Medicaid patients, CHC is entirely eliminating that threat. The barrier vanishes.
It's incredible. And they don't stop there. The source details that they also accept a wide, comprehensive range of other major insurances. They take Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. And for those patients, the copay is clearly detailed as $30 to $40 per session.
This right here is how the slow, ongoing practice of secure relating becomes actually possible for the average, everyday person. We established earlier that updating your nervous system's adaptations isn't a quick fix.
Right.
You can't just go to one session, get a breakthrough, and be cured. It requires ongoing repetition. It takes time. If therapy is financially ruinous, people simply cannot sustain it, and they are forced to retreat back to relying on those free 30-second viral videos for comfort.
Which just loops them right back into the problem.
Exactly. By utilizing a 100% telehealth model and securing broad insurance acceptance, practices like CHC make the actual long-term work of rewiring the brain sustainable.
It takes all of this high-level psychological theory out of the academic realm and makes it fiercely actionable. You don't have to just sit there and wonder what to do next. For anyone listening in Georgia who wants to transition from the digital sorting hat to actual supported healing, the source lists their contact info clearly.
It's a great resource to have on hand.
You can reach Coping and Healing Counseling by calling area code 404-832-0102. You can explore their team and specialties at their website, which is chalhtshitherapy.com, and you can email them directly to get started at support@cheatsheatherapy.com. It's all right there, a literal bridge over the murky waters.
It provides a very clear, tangible pathway. It invites people to step out of the isolation of self-diagnosis and into the structured, compassionate support of a professional relationship.
It really is a complete, full-circle journey we've gone on today in this deep dive. We started by debunking this incredibly pervasive, culturally dominant myth that attachment styles are these permanent, rigid personality boxes you get sorted into forever based on a 5-question internet quiz.
We unpacked the biology behind it. We explored how these styles are actually learned nervous system patterns, brilliant childhood adaptations that are fluid, plastic, and deeply dependent on the specific relational dynamics you are currently experiencing. We established that you are not broken. Your brain was just trying to protect you.
We looked at the very real danger of getting trapped in identity fixation, the trap of using a digital label as a shield, a permanent destination, rather than what it should be, a starting point for deeper work.
Exactly.
And finally, we saw how accessible telehealth options, specifically looking at CHC's model in Georgia, are out there providing a real, practical, financially viable path to the slow, pool-level work of healing.
Because true healing simply cannot happen in isolation. It happens in the messy, beautiful, ongoing practice of relating to others in a safe environment.
Exactly. Thank you so much for joining us on this deep dive today. Remember, whatever patterns your nervous system learned when you were younger, whatever strategies it adopted to keep you safe in the environment you were in, you are entirely allowed to update those adaptations as an adult. You are not permanently sorted.
You always have the biological and psychological capacity to change the pattern. You just need the right support to patch the software.
But before we go, we want to leave you with one final thought to mull over on your own. We talked at the very beginning about that incredibly common experience of scrolling through your phone late at night, letting the digital sorting hat tell you who you are through endless content.
We've all been there.
So ask yourself this. If your nervous system originally learned its specific attachment style to protect you from harm or rejection in the past, what is it trying to protect you from right now when you choose to scroll through endless self-diagnosis videos in your bedroom instead of reaching out to actually connect with a real human being?